Okay. Next, we have Senator DiPalma's bill, S-291. It's an act relating to State Affairs of Government, Office of Health and Human Services. And I see Mr. Senator DiPalma is with us. Senator DiPalma, please enlighten us.
Thank you, Chairman, members of the committee. This bill is nothing new to you. This is the fourth or fifth year bill has been introduced. It's changed a little bit over the last couple of years. I'll start by saying why this is important and what this bill does. The bill talks to a starting wage, does not talk to a minimum wage. And it talks to a starting wage by tying that starting wage to the minimum wage and allow it to happen item for an item as minimum wage go up over time, as we just passed, and assume that will move forward around the House. What this bill would seek to do, and why it's important, is the starting wage for health and human service workers, and that's what it seeks to address. It would tie the starting wage for health and human service workers for which the state contracts, and we'll get to that in a minute, to 155% of minimum wage. So as minimum wage progresses, so too with the starting wage for health and human service workers in the state of Rhode. A couple of facets that I've seen over my 13 years of addressing health and human services from a finance perspective, etc. We have contracted services where we actually have a contract with the service provider. We also have services where the state prescribes what the wages are. Where is that? For instance, in the DD realm, individual intellectual development disabilities, we have a budget of over $300 million. We prescribe, and it's formulaic, and it's been formulaic since 2011. The average wage there, or the wage that appears the most, not the average, is $13.08 per hour. Starting wage for those folks. And it only goes up pretty much when the state of Rhode Island increases. It took many years for the state of Rhode Island to increase that. If you look back in time a little bit, at one point, minimum wage was $7, based on the analysis I've done, and I have all of this. And the starting wage or the wage for individuals that work with DHDDH, predominantly individuals with intellectual development disabilities, was about $10. We all know now our minimum wage is $11.50. Going back to the number I said before, individual starting wage for working with direct care workers, working with individuals with intellectual development disabilities, and I've gone through all 3,610 folks because we gave them a raise about a year ago, October. The number that appears the most is $13.08. The services we provide to these folks are the most vulnerable individuals, whether it's individuals with intellectual development disabilities, folks with behavioral health care disorders, folks that have lived or treated at Eleanor Slater Hospital, either in Cranston or up in Zambrano. We have individuals that support children in the care of the state, DCYF. We have individuals that support folks from a Department of Human Services perspective, etc. Why is this important? We're losing these folks. If we look at what's transpired in the DD realm, there was potentially about a 33% turnover. Pick whatever epic you choose in time frame, about 1/3 of the folks would have turned over in that period of time. Vacancy rate of about 25%. So unless we address this, as these are folks that are working with, as I indicated, could be our family members, our state's most vulnerable, we need to make their wage commensurate with the work that they do. That's why it's important. That's why we need to do this now. What needs to come along with this is the state compensation, and we've heard testimony in the past with regards to opposing this bill, and maybe here today, I don't know what testimony you're hearing or not hearing today. Folks will indicate, well, they might be in opposition to this because those individuals with whom they are employed need to be paid. Absolutely. The state's accountable for these services. The state needs to pony up and pay for these services accordingly. So it would be incumbent upon the state to do that. There is no, one last piece I'll leave you, Mr. Chairman, members of the committee. When you read through the bill, this has no fiscal impact on the current fiscal year we're in, or the fiscal year with which we'll start July 1st of this year. FY22, which will begin July 1st of 21, and then June 30th of 22, is not impacted at all. This begins July 1st of 2022. It's important. These workers deserve it. And if I ask you how many potential employees we have working with individuals with intellectual development disabilities, there's well over 4,000 to 5,000 folks. And they're our neighbors, they could be our family members, our friends, and they're taking care of our state's most vulnerable population. Thank you, Mr. Chairman.
Thank you, Senator DiPalma. Are there any questions from the committee? Seeing none, we have, speaking on it is Bob Cooper from the Governor's Commission on Disabilities. Good afternoon, Bob.
Good afternoon, Mr. Chairman. Let me just, Hello, I'm Bob Cooper with the Governor's Commission on Disabilities. We're in support of Senator DiPalma's bill. Just to give you a little comparison in terms of wages between the direct support professionals Senator DiPalma was just talking about. In Providence, there are advertisements right now for cooks with no experience, and the starting wage is $14 an hour. Janitors, it's $16 an hour. Fast food clerk, it's $14. At the Burger King with no experience, you can be a checkout clerk, starting at $18. Grocery stockers, it's $13 an hour. Grocery clerks, it's $16 an hour. Now remember, these direct support professionals, whether they be a personal care attendant who is picking somebody out of bed, cleaning them off, feeding that person, helping that person get dressed, can make a lot more with a much easier job. And if I looked around in the New England states in terms of what's the average for direct support professionals, Boston, it's $15.64. Hartford, Connecticut, $15.24. Montpelier, Vermont, it's $14.35. Only Augusta, Maine, and Concord, New Hampshire are paying less than what Senator DiPalma was just talking about in terms of the entry-level wage. These are difficult jobs to do, and as Senator DiPalma mentions, there's a very high turnover, and that also interrupts continuity of care, especially for folks whose life needs to be pretty stable. I'm here to answer any questions that you and the committee might have.
Senator Lombardi, is there a motion?
I would move to hold for further study, Mr. Chairman.
It's a motion to hold. Do I hear a second?
Second, Senator Lombardo.
Okay. With that, any discussion? Being none, Mr. Clerk.
Senator Burt.
Yes.
Senator Dela Cruz. Senator Golden.
Aye.
Senator Lombardi.
Yes.
Senator Lombardo.
Yes.
Senator Picard. Senator Sosnowski.
Yes.
Chairman Chacon.
Yes. Okay.